Okay, perfect. So I'm going to introduce myself. My name is Stephanie, and I'm a physical therapist in Dallas. I've been a physical therapist for, gosh, I can't believe it's been almost 20 years because I don't feel like I'm that old. But I grew up super active, was like a gymnast, then played soccer, college soccer, semi-professional soccer, got into marathon training. So just super active, was always curious about how the body works. And that's kind of what led me into physical therapy, because I was just really interested in it. And some of the things we'll talk about that we're going to get into is just understanding, like, a lot of times in our healthcare system, we tend to go to the side of the pain, like that's where the problem is. And in reality, I always tell people where the side of the pain is often not where the source of the problem is. And one of the things that we'll get into too a little bit is that, you know, I always ask why. Well, why did this happen? So if we had an injury, why did we have that injury? Because most of the time when you see people that come into our office, you ask them, well, what did you do? Well, I'm not really sure what I did. And so you have to go into like lifestyle things as to why this is happening, because if you go and you, help with the pain, then essentially what happens is you just go right back to the same activities that created that, and then you have it come back again. And so that's a lot of the things that we ask. So I'm going to have Ben on and kind of introduce himself.
My name is Ben. I'm the other physical therapist up here. I got into physical therapy after being a patient myself, like kind of from the time I was in high school through college. And I knew that's what I wanted to do. But when I got out into the working environments that are typical of our profession, it wasn't great. We weren't able to spend enough time with people. And that's what kind of led me down this road to start working with Stephanie, so I could spend more time with people and actually figure out what was going on with them and actually solve their problems in a more timely manner.
Yeah, so one of the big things that is a really big myth, so we'll get into a few things up front, and then we'll go into kind of treatment, some kind of common injuries that we see with runners. So one of the big myths that I have been talking about is MRIs, and how that really doesn't give us a lot of information, and how that also leads to unnecessary treatment. So let's talk about that first.
So with MRIs, I mean, the big problem is it's not, it may identify something that's wrong in your body, but it may not be the source of the issue that you're having. So especially people that are, you know, they'll come in, they've had pain for maybe a month or so, and they'll be like, well, you know, the MRI showed that my hip had, you know, a bunch of arthritis in it or something like that, something degenerative. And, you know, but they've only been having pain for 4 weeks. I'm like, well, it didn't, you know, that didn't happen in 4 weeks. That was probably there before you ever had any of these symptoms. And it wouldn't be, you know, you don't just wake up one day and start having pain from arthritis or anything degenerative. So really the main problem with MRIs is that they're not identifying the source of your issue. They're just taking a picture. So just because something's there, it doesn't always correlate over to what's going on with you functionally, or what's stopping you from being able to do what you want to do.
Yeah, if you look at the research on MRIs, it's not great. Like, you could literally, like, this is like research after research after research after research. If you took the sum of them, you could take 100 people, no pain whatsoever, fully functional, and you could find people that have rotator cuff tears, but they're fully functional, they have no problems. You can find people that have meniscal tears. You can find people that have labral tears. You can find people that have degenerative changes. And these are all things that happen, but yet they don't have any problems. And when I say that there's a lot of people that have it, like 60 to 80% of people that are fully functional are going to show something on MRI. So when all of a sudden you just start hurting, and you image, well, was that something that was there before, or was that something that was there after? And we had, recently, have another one coming in next week that imaged rotator cuff tear, and one of them that we just finished treating her, she was one of my friends, and I said, are you sure? And she said, yeah, I've had physical therapy, didn't work. And I'm like, but did you look into the spine, like the thoracic spine, the neck? And they're like, no, but come to find out, like, I've been having some issues there for a while. And sure enough, she had this surgery scheduled. And, within like 3 weeks, she was feeling so much better. Her arm was like fully functional, and she's wasn't she still needed some therapy, but she was doing so much better that she canceled her surgery. And we see stuff like this all the time. And I like to tell people that it's kind of like, you know, we get the degenerative changes or the things that are happening within our body. It's kind of like wrinkles on our face. It just happens as we get older. It doesn't mean that there's a problem. So if you have like arthritic changes or degenerative changes or wear and tear, what they say, those are things that just happen. Like they happen as we get older, but that doesn't necessarily mean that that's where the problem is coming from. And that's why we like to go into like imaging and don't put a lot of clout in that, because like I said, where the side of the pain is not often where the source of the problem is. And that's where we miss the boat in healthcare. Another thing that I always like to go into is like medications, because so often you go into the doctor and you're hurting, and the first thing they want to give you is pain pills, muscle relaxants, and anti-inflammatories. Like that's the first thing that they want to do. And again, we've got to get down to figuring out, okay, what's the source of the problem? And so we feel pain in 3 different ways. We feel pain chemically, and I'll explain it. We feel pain mechanically, we feel pain thermally. So thermally would be like burn, sunburn. So let's take those off the plate. Chemical pain is like that, oh, just like had an injury, you have that inflammation that comes in, it's constant, it's throbbing, it's aching. You have all the chemicals coming in. And so you can treat chemicals with chemicals because that would be addressing that exact area. But if you have a mechanical issue, and that's the mechanics, that's when you come into like a mechanic like us and figuring out like what's going on, what's creating some of the problem, how is there parts that aren't like, is there a mobility issue? Is there a strength issue? Is there compensation? Like what is going on with those mechanics that are creating the problem? You've got to address the mechanical issue of it. If you address it with chemicals, it doesn't work, which is why a lot of times when you go in and you get medications or you get an injection or you get, you know, you may feel like, well, it helped a little bit, but I'm still having issues. Or why people get an injection and it works for a little bit and then it comes back again because they never really got down to the root cause of what was going on or why it was happening and fixing a lot of those things. So medications, it's so easy. You can ask yourself like these 2 questions to know if it's mechanical. And one question is, do you have pain all the time? If your pain comes and goes, that's not chemical. You don't have like, whoop, I have inflammation for 30 minutes and then, oh, it's gone. Oh, it's back again. It doesn't work that way. So if your pain comes and goes, then drugs won't help. So if you go to a doctor or even injections won't really help. If you even if you have pain kind of all the time, but you can change your position to make it better and worse, that again is mechanical. You've got to address the mechanics of that. And you can have things that can be chemical and mechanical, but you can address some of the chemicals with drugs, but you've got to get into the mechanics of why it happens. And that's often what happens is you'll go to the doctor and they're just going to throw some medications at you. And it's like, okay, great. The best is, well, just rest. And I'm like, rest doesn't work either. If you've been hurting for longer than like a week, rest isn't going to help you. You'll rest and then you won't hurt because you aren't doing the things that make you hurt, but then you'll go right back to those same activities and it'll come right back again. So unless it's something that's like, give it 2, 3, 4 days and it kind of goes away, then great, it goes away and you're going to be fine. But if it's lasting longer than that, you're going to have some issues and they definitely need to be addressed. You want to add anything, Ben?
Yeah, I mean, I think the research is kind of split right now, especially with like anti-inflammatories and stuff, because really the inflammation process is what's going to help you heal anyway. So that needs to go on for a little bit. And if we're blocking it with pills, then you're getting in the way of your own body healing itself. I mean, I think it can be beneficial. Maybe if you're hurting really bad and you just can't even sleep and things like that, you know, in those first few days, when it really is that inflammatory pain. And I mean, the other side of the pills and injections things is just have this opioid crisis going on right now. So probably don't want to go down that route. But yeah, I mean, I think when you're told to just go on and rest, I mean, that almost makes your problem worse because you're just adding to you're adding to everything else that's going on in that system. So you're making your muscles are staying weak basically, which is they don't need to do that. And you may have new aches and pains from just, resting so much and not moving around.
Yeah, and let's get into like probably one of the most common things that I find with runners, and it's that high hamstring. People will feel a little bit differently. Maybe it'll be a little bit more in like the glutes. So the doctors usually will diagnose you with like, oh, you have bursitis or tendonitis in the hip. They'll say those kind of conditions, or they'll say it's piriformis syndrome, or it's a little bit lower and it's in that hamstring area. And it is so common. And a lot of times what you'll find is people will do, and we've had it, like, I don't know, we get people that have tried everything and nothing has worked. And they'll get into like doing ART, soft tissue, like and just beat it all up, within the hip, but then they're still having that issue. And sometimes it'll stop people from actually running. And sometimes it's like, I can still run, but I just kind of run through it. And what people miss out on, a lot of times we don't even address like even into that hamstring. The hamstring is actually a symptom of what's going on. And a lot of times if you look into what we find is it's the hip mobility is lacking. You'll see it. And a lot of, I'll ask like, yeah, you probably can't get into like the pigeon position, or you really try to force it down. Like you're really limited in that figure 4 position, and you just keep on stretching it, trying to get that hip to open up. And in reality, it's the wrong direction. If you look at what happens is you've lost like hip extension, so you can't move the hip backwards. And usually it's some sort of hip extension with some sort of rotation of improving that mobility. So we've got to get the joint to move again. And we can open up that hip to where all of a sudden, boom, they can do pigeon, or their figure 4 opens up pretty quickly. And we do have to do some tightness, like soft tissue just releasing as we are opening the hip joint, improving that mobility. And so what we find is that people will do the soft tissue piece. And sometimes, like, we've had triathletes that come through here and they've been through ART, which was great because it helped us out because we didn't have to do as much soft tissue, but they never improved their mobility. And so you've got to get the mobility better, and then you can work on the stability, which is some of the strengthening things. And the next piece that happens with that is because they can't push off to get that hip extension to really drive themselves forward. They've really lost a lot of the strength in those hip extensors. So they'll be stronger on the outside of their hip, which then will give people issues within that IT band sometimes. Because they're getting their stability from there, but they're not getting it from that hip extension piece of it. And so we've got to slowly work on getting that stronger. And then that's going to start translating to running to where they're like, oh my gosh, I'm able to run again. It's the first time I haven't hurt. And we get people like this all the time. We see this. This is probably one of the number one things that we see with runners that people have so much frustration with because they can't figure it out. And people say, oh, it's your hip flexors are so tight. Well, we find like that the quad even will be so tight that when we get the hip to open up, the quad will like within one treatment, the quad flexibility opens up, and it was more of a protective type mechanism versus, the quad is so tight. So that's one of the big things that we see with runners. Do you want to add anything else to that?
Yeah, I think it's really about finding those habits, that maybe you can't see when you're in the moment and you're that person. It's because you're not going to be running and be like, oh, well, I don't feel like I'm pushing through my hip if no one's pointing it out to you really. But it's about finding that source of the pain, and that could be higher up in the hip when it's your lower leg. And we can kind of see that stuff all the time. And especially going back to the MRI thing, if they take an MRI of your lower leg, then that's not going to tell them anything about the hip. So, really having someone sit down and go through all those things and look all the way up that chain is so important, especially with runners and people that are doing dynamic activities that are high impact, because it may be really small too, but you're doing so many steps and over such long distances that stuff builds up, so it really takes, digging in and taking the time to figure that issue out.
Yeah, and it presents differently on everyone, but a lot, like you'll get it in that high hamstring. But we had someone that just was in here the other day, and he does like 30,000 steps a day, and he's to the point where he can't do it, and his translate into his foot. And literally, I'm like looking at him like, and I'm just like, man, do you see that? Like he can't even get that foot down. Like he was sitting with the outside, his foot was on the outside border, and he couldn't even bring the foot down. I'm like, that's so interesting. And so we're asking him to do a few things, even just sitting. He had to bring his knee all the way over because he couldn't even get the foot to go down. I'm like, ooh, there's got to be something going on in the hip. And it was interesting. Like we found like that his ankle did not have hardly any mobility. He had no side to side motion with his ankle. So we were having to work on that. But when we went and looked into his hip, we actually looked at the like rotation of his hip, and like you couldn't even move it internally. So he couldn't even get his foot to like actually plant where he could push off his toes because he didn't have the mobility to even do it. So people have been trying to do strengthening exercises with him. Because yeah, I've been trying to enforce it. I'm like, well, you can't. You don't have the mobility yet. So we've got to improve that piece of it first. And then we have the tendonitis piece because he's overworked that area, and that's like the next thing that we really see a lot of with runners. Why don't you go into some of those kind of things?
So with tendonitis, that's one of those things that you really can't rest with to get it better. Maybe in those first few days, if you're really flared up, but long term, if you really want to get back to what you're doing, then rest is not the answer. So what's going to happen is you're going to rest, and then you're going to try to go back and run, and so it's going to flare up, and you're just going to be stuck in this cycle. And then all the while you're doing that, the muscles around it, and probably the muscle where the tendon attaches, is getting weakened because you're not able to do those activities. So you're just stuck in this cycle where you're kind of flaring it up over and over again. You're trying to rest, but that doesn't get you over the hump. So really what we try to do is help people by figuring out, hey, what's the source of this? Is there something else going on besides that tendon itself? But also about kind of finding the right level of that exercise to where, okay, you're not flaring up so bad that you're increasing your pain substantially where you can't, at least do some activity. And then, finding that sweet spot of like, all right, this is the exercise that's actually going to get you over the hump in the long term and make you do where you can, gradually get back to that activity.
Yeah, it's the tendons are a loading structure. So if you overload it, then it's going to flare it up. And if you underload it, then it's going to not help you. And so loading meaning like exercises or putting a force through it. So like walking is going to load the structure differently than running. Running is going to be a higher level loading because you're putting a lot more force down on it versus walking. And so if what happens is we tend to go from underloading to overloading, and so you get in this vicious cycle like Ben was talking about. And so you've got to do enough exercises to gradually build the tolerance so that tissue can get back out there so that it can take what you want it to do with the running. And so often with like treatments that people do is they focus so much on the tendon, or they'll do a lot of soft tissue, which is great. Like we do that, but it's a loading structure. It's meant to like respond. So if you think of like a tendon in the foot, like whether it's Achilles or posterior tib or peroneal, whatever it is, it's like, think of like a basketball that's full. If you take the basketball and you put it to the ground, it has a reaction to be able to spring up. Like that's what our tendons are supposed to do. They're supposed to give us that reaction so that we can explode. But if we have a basketball that's kind of like lost air, it's like we put so much force down on it, like so much force to try to get the same reaction, and it doesn't work. And that's kind of what's happening is you're putting so much force on it, it's not reacting, it's not doing its job, that we have to retrain it to be able to do that. And that's where the problem comes into play. So if you go in and just do soft tissue because there's so much tightness, which happens all the time, but you don't actually retrain it to be able to get that spring back, then you're in that vicious cycle. It's like, well, I feel good. It feels great. I can actually walk now, but now I'm going to go back to running. Oh, gosh, it's back again. It hurts. And you see people going through this all the time. And if you don't get into like retraining it, you're never going to get back. We've had people that have been told that they need to have Achilles surgery. And Achilles surgery, if anyone's ever done it, it takes a year sometimes over a year to be able to get back to running, literally. And what happens when they have tendonitis so bad, they literally want to just cut the tendon and reattach it. So you're starting the whole process of healing over again. When in reality, if you just load the structure and gradually build it up, we've been able to get people back in like 3 months back to running. That's a whole heck of a lot better than a year. With something like an Achilles, with things that are like peroneal tendonitis and posterior tib tendonitis, those don't take as long. But with that Achilles, depending on how bad it is, it can take a little bit of time to get back to. And a funny story, how this all started as far as understanding that tendon a little bit better. There was a guy that published research, and there were 2 doctors, orthopedic doctors, that were in Canada. And literally, the one doctor was having Achilles tendonitis, and he said, "I want you to do surgery on this so I can get back." And he goes, "Oh, it's not bad enough." And so he was like, "But I want you to do surgery." "I'm not going to do surgery on you. It's not bad enough." And so he literally started loading up like weights in a backpack and started doing heel raises and started like trying to jump on it to try to tear it so that his friend would actually do surgery on him. And what he found was, as he was doing some of these things and getting him back, he goes, "Oh, my pain went away." And he didn't actually have to have the surgery. And that's the concept. He basically just, loaded the structure up enough to where it wasn't like super inflamed, but there's a happy medium there, and he no longer needed to have surgery. So these are things that are super common. And it's also why like, massage therapy is fantastic. It's something that totally can help keep people away from having injuries. But if you have an injury and that's the only piece that you hit, it's not going to work. You've got to get into why that's happening, and you've got to get into what's going on, and from a mobility standpoint, from a strengthening standpoint, from a compensation standpoint, to get you back to all of your activities. You have anything else, Ben?
Yeah, I thought I'd just draw like a diagram of like why like loading a tendon works. So let me make sure that this is aligned up here. So let's say that like this is your Achilles tendon there. You got your muscle up here, runs your leg. So the force would kind of move this way along it. So really what happens when, like let's say we're pointing our foot down, like we're going to step on a gas pedal, this tendon expands, so it moves out this way. So when we start having tendon issues, it loses its ability to expand that way. And what will happen is we'll have these little micro areas where it's getting some breakdown just along it. So it can no longer transmit this force down the tendon by expanding. So what we try to do when we rehab it, and why loading works so much, is we're actually treating these good areas right here. And we're having them pick up the slack of these areas that are having more trouble. So when you go to put force through it, these other areas can compensate. And that's just the short term. So like in the long term, the loading activities actually stimulate healing in these areas. But short term, I mean, tendons just don't have a great blood supply, so they just take a long time to heal. And that's why if we want to get relief in the short term, then we just got to strengthen these structures right there. But we got to do it to a point where, we're not flaring them up over and over again, because that just slows down the whole process, really, because you're not able to do the repetitions that you need or to load it enough, because it's flaring up over and over and over again. And you're just, you go back to that cycle. But really, it's just all about, figuring out the right level. And then, we use some manual therapy techniques and things like that to kind of help it along the way, as far as, controlling the symptoms and helping with any other tightness or anything up the chain that may be going on.
And before we kind of open it up for questions, one of the things that we thought we would do for this group is, if any of you guys are having any issues, we'll open up some spots where you can just either come in if you want to, you don't have to, and sit down and we can talk a little bit more through it, or on the phone where you can talk to one of us. And so I'll put a link in here before we finish up on that you can sign up for that. Or tomorrow you'll get an email too where you can actually sign up for it as well. There'll be a link there. So just in case you don't get it here, don't worry, you'll get an email that will allow you to sign up for that. And then we also, in that email, I have a lot of different free reports because we love just to provide education. But there'll be a back pain free report, there's a knee pain free report, and there is a neck and shoulder pain free report. So you guys can like click on that and you'll get the free report sent to you. So if you have anything like that, you can definitely get started there. But I'm gonna stop the recording and we can answer any questions that you guys have.